Question number 6 on Americans Elect. What do you think is driving the rapid growth of healthcare costs, and how would you slow it down? Would you support putting some kind of cap on what the government spends on Medicare? Well, first of all, there's some non-government causes for the escalation in healthcare costs. If you look at inflation as probably the primary driver in facilities, equipment, and labor. You have demographic shifts that more people in the baby boom generation are now entering into the age where longevity enters into it. And when you talk about longevity, you're really talking about capabilities improvement. People are simply living longer. But let's look at the government aspects of it. We've already talked about the fact that we need to eliminate any type of regulation that doesn't deal effectively in healthcare with providing better delivery of quality care and more accessibility to it. We should also eliminate any type of redundancy among healthcare departments and agencies. We ought to prosecute fraud far more aggressively in the healthcare sector to drive costs out. We should implement tort reform, a loser pays approach to vexatious litigation, as well as perhaps initiating a movement towards mandatory reprimands or suspensions or even disbarment for chronic offenders within the legal profession. And then I think we have opportunities to reevaluate the efficacy of our clinical trials to speed time to market and lower the cost. Also look at mortality and morbidity rates associated with healthcare related disease. And when it comes to Medicare, I would suggest that we restructure it rather than cap it, because that's just one less chance for the government to play God.